here we can see the specimen of the brain which is kept. So first let us look at the specimen of the brain, and then I'll talk about the various coverings of the brain, that is also referred to as the meninges of the brain, that is also referred to as membranes of the brain, and then we'll cover the base of the brain, the various cranial nerves related with the base of the brain, and then the various blood vessels at the base of the brain. Okay, so this will be the flow of this particular session. Okay, first let us see the various parts of the brain. So here we can see the two cerebral hemispheres. We are viewing it from the superior aspect. Let's view from the lateral aspect. So here we can see this is the temporal lobe of the cerebral hemisphere. Now let's view from the inferior aspect. So here we can see the cerebellum, the medulla oblongata, the pons, and above it there will be the midbrain. So this is the brainstem which is seen in front of the cerebellum. Okay, and whatever we can see now, this is the base of the brain. Okay, so today's prosection session is about the base of the brain and the coverings of the brain. Okay, first let's cover the coverings of the brain. So here we can see a covering of the brain. So which all are the coverings of the brain? So there are three coverings, right? The outermost layer is the dura mater. So there is a dura mater which I am holding in the hand. There is dura mater, arachnoid mater, and pia mater. Okay, so these are the three coverings of the brain, and these coverings also continue in the spinal cord. Okay, in the spinal cord also you will be finding these coverings. Okay, so if we see the brain, on the outer aspect the covering is this is the dura mater. Once we cut open the skull, first we will expose the dura mater, right? And once we remove the dura mater, we will view the brain specimen. Okay, so here this is the specimen of dura mater, and various folds of the dura mater you have already covered. So you all can just recollect which were the folds of dura mater. So now we are viewing the dura mater from the inner aspect. So here this fold of dura mater which we can see, this is the falx cerebri, which is in between the two cerebral hemispheres. Okay, so the right and the left cerebral hemispheres will be occupied in this region, and in the middle there is falx cerebri which is seen. Just like in between two cerebral hemispheres there is falx cerebri, similarly in between two cerebellar hemispheres there is a fold of dura mater which is referred to as falx cerebelli. Okay, so this is the falx cerebelli. Then this fold of the dura mater which we can see, this is the tentorium cerebelli. Okay, if seen in anatomical position, the part of the brain below the tentorium cerebelli will be the cerebellum. Okay, so in this region the cerebellum is located. So anatomically, if we see, below the tentorium cerebelli is cerebellum, and above the tentorium cerebelli is the cerebral hemispheres. Okay, particularly the occipital lobe of the cerebral hemisphere will lie here. Okay, in this region, and below the tentorium cerebelli the superior surface of the cerebellum will be located. Okay, and there is one more fold of the dura mater which you might have seen in the cranial cavity near the location of the pituitary gland, that is the diaphragma sellae. Okay, so these are the four folds of the dura mater. I'll repeat the names of the all four folds once again. One is the falx cerebri, and falx cerebelli, then tentorium cerebelli, and diaphragma sellae above the pituitary fossa. Okay, so these are the various folds. And when you learn about the folds, you will have to also learn about the various sinuses in relation to these folds. Okay, so you all can read the theory aspect of this. Okay, in this particular session, I'll just cover which all structures are seen in the specimen. So one fold, that is the dura mater, we covered. There are two other folds as well. In this specimen we can appreciate the arachnoid mater. Okay, here we can see the part of which I have pulled up from the brain substance. This is the arachnoid mater. Okay, and below the arachnoid mater we can see the brain substance, and pia mater is closely adhered to this brain substance. Okay, that cannot be picked up. Okay, and just below the arachnoid mater is the subarachnoid space, and the subarachnoid space contains the blood vessels of the brain, the various arteries and the veins which drain the brain, supply and drain the brain. So those are located in the subarachnoid space. Okay, subarachnoid space also contains the cerebrospinal fluid. So I'll repeat the three layers once again. The dura mater, there are alternative names of these meninges as well. Dura mater is also referred to as patchy meninges, and arachnoid mater and pia mater is also together are referred to as leptomeninges. Okay, the word dura means thick. Okay, it's a thick coat, it's a thick fibrous coat which is covering the brain. Okay, and the word arachnoid means a spider's web. Okay, so it's like a web like protection of the brain. So that is the arachnoid mater. And the pia mater, the word pious means soft. Okay, so it's a soft membrane which is covering the brain. Okay, so these few alternate names also you are supposed to know with respect to the membranes of the brain. Okay, now let's cover the base of the brain and the various structures in the base of the brain. So in this specimen we can see the base of the brain. Let's identify various parts of the brain which is seen in the base of the brain. This is which part of the brain? This is the frontal lobe of the brain which is seen from the inferior aspect, right? You can appreciate from the superior aspect, this is the frontal lobe. So the same frontal lobe is seen on the inferior aspect here. Okay, so here is the frontal lobe, and which part of the brain is this? This is the temporal lobe. Okay, and going behind this region, this is the occipital lobe. Then which structures are seen here? This is the cerebellum. Okay, cerebellum, and in front of the cerebellum we can see the brain stem. Okay, so brain stem has got three parts from superior to inferior. If we see, there is midbrain. So here we can see this part is the midbrain. So there is a specific part of the midbrain called as cerebral peduncles which are seen here, and this is the pons, and this is the medulla oblongata. Okay, so anatomically from above downwards you will have to speak about the various parts of the brain stem. So grossly these were the various parts of the brain seen in the base of the brain. I'll repeat again: the frontal lobe of the cerebrum, the temporal lobe, the occipital lobe, then cerebellum, and the three parts of the brain stem, right? Now let's understand which all other structures are seen in the base of the brain. Let's start with the cranial nerves related with the base of the brain. So as you all know that 12 cranial nerves. The first cranial nerve, what is the name of the first cranial nerve? That is the olfactory nerve. Olfactory nerve arises from the roof of the nose. There are multiple olfactory rootlets which pass through the cribriform plate of the ethmoid bone in the anterior cranial fossa, and they form an olfactory bulb. Okay, in this region you will be able to appreciate the olfactory bulb, which is not seen clearly in this specimen. And once we trace the olfactory bulb behind this nerve which is seen, this is the olfactory tract. Okay, so this is the, so here in this region we can show the olfactory tract. And the second cranial nerve is this, that's the optic nerve. Okay, so here we can see the cut ends of the optic nerve, and once we trace the optic nerve behind, it has a crossing in the center, that is the optic chiasma, that continues as the optic tract. Okay, so optic nerve, optic chiasma, which will continue as the optic tract. Okay, so two cranial nerves we have covered. The third cranial nerve, which is the third cranial nerve, that is the oculomotor nerve. Okay, this nerve which we can see, this is the oculomotor nerve. It is identified between two blood vessels. Name of those blood vessels are posterior cerebral artery and superior cerebellar artery. Okay. Then the fourth cranial nerve is trochlear nerve. It is not seen very clearly in this specimen. There is one more specimen I'll show in that. So here in this specimen, try to appreciate the trochlear nerve. So just adjacent to the oculomotor nerve, we can see this thin nerve which is seen. This is the trochlear nerve. Okay, that's the only cranial nerve that arises from the dorsal aspect of the brainstem. Okay, rest all cranial nerves, they are arising from the anterior aspect. Then fifth cranial nerve. Let's see the fifth cranial nerve here. This is the fifth cranial nerve which is seen in the pons. Okay, it is the thickest of all the cranial nerves. Okay, that's the fifth cranial nerve. Then sixth cranial nerve, it is located at the pontomedullary junction. Here we can see this nerve at the junction of pons and the medulla oblongata. Okay, at the pontomedullary junction you can remember three cranial nerves, the sixth, seventh and the eighth cranial nerve. Okay, the sixth cranial nerve is along the medial aspect, and seventh and the eighth cranial nerve, they are more towards the lateral aspect. So here we can see on the lateral aspect, this is the eighth cranial nerve. Okay, and one more nerve which we can see here, that is the seventh cranial nerve. Okay, this is the seventh cranial nerve, then eighth cranial nerve. So from medial to lateral, the nerves are sixth, seventh and the eighth cranial nerve. Okay, then talking about the last four cranial nerves, the last four cranial nerves are related with the medulla oblongata. Okay, so if you have read about the external features of the medulla oblongata, you will be able to know the various attachments of these last four cranial nerves. This is the region of anterolateral sulcus between the pyramids and the olives. Okay, in the anterolateral sulcus, the nerve related is the 12th cranial nerve, the hypoglossal nerve. We can see certain rootlets here. Can you appreciate this small rootlets between the pyramid and the olive? Okay, the anterolateral sulcus gives attachment to the rootlets of hypoglossal nerve, and behind the olives and the inferior cerebellar peduncle, there is a groove which is referred to as posterolateral sulcus. Posterolateral sulcus gives attachment to the rootlets of 9th, 10th and 11th cranial nerve. Okay, so three cranial nerves are related with the posterolateral sulcus, and 12th cranial nerve is related with the anterolateral sulcus. Okay, so this was all cranial nerves related at the base of the brain. Let's quickly revise the various cranial nerves. The first cranial nerve, that is the olfactory tract, which is seen here. Then optic nerve, second nerve. The third cranial nerve is the oculomotor nerve. Okay, then fourth cranial nerve was the trochlear nerve, arising from the dorsal aspect. Fifth cranial nerve is trigeminal, which is not seen clearly here. Then the sixth cranial nerve is the abducent nerve at the pontomedullary junction. Then 7th, 8th on the lateral aspect of pontomedullary junction. 9th, 10th and 11th along the posterolateral sulcus. 12th now along the anterolateral sulcus. Okay, so this was the superficial attachments of the cranial nerves. Details of this, the further course and the exit through the skull also you will have to read about. Okay, then let's see other features which are visible in the base of the brain. Uh, Behind the optic chiasma, there is an elevated part of the brain that is referred to as tuber cinerarium, and behind the tuber cinerarium, these two rounded structures which we can see, these are the mammillary bodies. Okay. Now coming to the last part of this session, that is the blood vessels which are seen at the base of the brain. Let's see a different specimen for that. So in this specimen we can appreciate the blood vessels seen at the base of the brain. When you read about the blood vessels supplying the brain, there are two chief arteries which are important. One is the internal carotid artery and other is the vertebral artery. Okay, so there are two vertebral arteries which unite to form an artery which is called as basilar artery. Okay, here we can see the basilar artery which is in front of the pons. There is a groove which is referred to as basilar groove. This is the basilar artery. Here you can see the two cut ends of the vertebral artery. Okay, the two vertebral arteries are uniting to form the basilar artery. Then when we trace the basilar artery forwards, the terminal branches of the basilar artery are the posterior cerebral artery. Okay, this blood vessel which we can see, this is the posterior cerebral artery. Okay, three cerebral arteries are of importance: the anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. Okay, out of which the posterior cerebral artery is a branch from basilar artery, and anterior and middle cerebral arteries are branches from the internal carotid artery. Okay, so here we can see the cut end of, this is the cut end of internal carotid artery. So let's identify the anterior and the middle cerebral arteries as well. For the middle cerebral artery, we will have to look in this region. This is referred to as the stem of the lateral sulcus. Okay, when you look at the superolateral surface of the brain, there is a lateral sulcus. When we retract it, you will be able to clearly appreciate the middle cerebral artery. Okay, and the vessel which is going on the anterior aspect, this vessel we can see which is going towards the median longitudinal fissure. So this blood vessel is the anterior cerebral artery. Okay, so anterior cerebral artery and middle cerebral artery both are branches from internal carotid artery. Then other branches, if we see from the internal carotid, there is a branch which is coming on the posterior aspect. This is referred to as the posterior communicating artery. Okay, so there are two communicating arteries which have been described, and in this region the blood vessels are referred to as circle of Willis. They form a circular structure here, somewhat circular. So which blood vessels form the circle of Willis, that is important. So for that we can see the thing which we had covered, the basilar dividing into posterior cerebral arteries. Okay, so posterior cerebral artery is a component of circle of Willis, and from the posterior cerebral artery there is a communicating artery towards the internal carotid artery. So posterior communicating artery is a component, then internal carotid artery itself is a component, then the branch which is given, the anterior cerebral artery, and there is a communicating branch between two anterior cerebral arteries, that is referred to as the anterior communicating artery. Okay, and similarly we can repeat on the other side. Okay, that's how it will form a vessels which are referred to as circle of Willis, and this is also referred to as circulus arteriosus. Okay, and few blood vessels or few branches of the basilar artery are also seen here. Here we can see the anterior inferior cerebellar artery, then labyrinthine artery. Okay, and this is the superior cerebellar artery, and the terminal branch of basilar artery is the posterior cerebral artery. Okay, when you read about these blood vessels here, the fourth part of the vertebral artery has got 5 branches, the basilar artery has got 5 branches, the cerebral part of this internal carotid artery has got 5 branches. Okay, so details about this you all can read, and whatever vessels which were visible I have shown you in the specimen. Okay, so this was all about this session, and so what all topics we have covered in this session: the membranes of the brain, also referred to as the meninges of the brain, then various structures in the base of the brain along with the superficial attachments of the cranial nerves and the blood vessels in the base of the brain. Okay, thank you.